Hello everyone, today I'll be talking about phobias. Almost everyone has a phobia. Before I start, I would like to ask you a question. What do you fear most more than anything else? Perhaps you hate spiders or you don't like heights. Maybe the thought of giving a class presentation in front of everyone scares you a lot. Everyone is afraid of something. These fears are all normal. Lots of other people feel the same way that you do. But what if spiders scared you so much that you would not walk outside your home? What if you were so terrified by heights that you would refuse to even look through your window? People have specific powerful fears suffer from phobia. Mental health professionals classify a phobia as an anxiety disorder, and this is what a phobia means. Phobias are considered the most common psychiatric disorder affecting almost 10% of the population. Phobias can literally be anything. Pyrophobia, the fear of fire. Electorophobia, the fear of chickens. Triskaidekaphobia, the fear of number 13. Phobophobia, the fear of developing phobias. And pinaclephobia, which is the fear of lists. Effects of phobia in the daily life. Unreasonable or irrational fears get in the way of daily routines, work, and relationships because patients with phobias might try to do whatever it takes to avoid the anxiety and terrifying feelings associated within the phobia. For example, most people don't necessarily enjoy the company of a spider, but they also don't let it affect their social or daily life. Even though they know there are spiders in the wood, that doesn't mean that they wouldn't go on a camping trip on account with the spiders. On the other hand, even if they love camping, somebody with arachnophobia, which is the fear of spiders, might refuse to go just because they know that there is a possibility of seeing a spider in close quarters. The fear is clearly interfering with their social life and relationship with friends, meaning it's a phobia. Now, what is specific phobia? An irrational fear of an object or situation is called a specific phobia. Specific phobia is divided into 5 major categories. Fear of animals, for example, arachnophobia. The fear of the natural environment, for example, astrophobia or hydrophobia. The fear of situations, for example, glossophobia or claustrophobia. And the fear of medical treatments, for example, hemophobia. And then other fears like fear of clowns. These specific phobias are one of main 3 types of phobias. The other 2 types are agoraphobia and social phobia. Agoraphobia and social phobia. Now for the agoraphobia, it means fear of public spaces. But it has to do with being fearful in a public space where it feels like it might be hard to escape quickly and return to a place perceived as safe, for example, a person's home. Therefore, people with agoraphobia tend to venture out very often. Some commonly feared areas might be places like crowded shopping malls or theaters where it might be very difficult to escape quickly. Social phobias, on the other hand, are overwhelming and persistent fears of social situations and interactions. People with social phobias are fearful of being embarrassed or judged by others. Being embarrassed or feeling awkward in a social interaction from time to time is totally normal. But people with social phobias often feel anxiety weeks before they happen to face any event. And some people are afraid of doing common things in front of others. For example, someone with a social phobia might be afraid to eat in front of someone else. For people with phobias, seeing, being exposed to, or even thinking about phobia causes very severe anxiety that's often not proportionate to the threat. They'll catastrophize and jump into the worst-case scenario, and these thoughts can lead to physical symptoms. Now, what are the symptoms of phobias? Excessive sweating, trembling, and increased heart rate. That being said, it is important to clarify and know the difference between an everyday fear and a phobia. Feeling dizzy while you're climbing a ladder would be an everyday fear. Avoiding your favorite frozen yogurt place because it's on the 2nd floor of a building, that's a phobia. Feeling weirded out because your best friend has a pet snake is an everyday fear. But avoiding your friend's house just because they have a pet snake, that's a phobia. Now, what causes phobia? Now, we don't really know what exactly causes phobia, but we do know that you're more likely to develop one if you have a family member with a phobia. course, sometimes phobias might be caused by specific traumatic events. Different patients respond differently depending on the therapy, especially if other conditions are involved like depression or drug abuse. Psychotherapy, particularly cognitive behavior therapy, can be super beneficial for patients. The treatment for phobias. Cognitive behavior therapy teaches patients to be mindful that their fear is irrational. The likelihood of their worst fears coming true is actually very low. Patients first learn to identify the anxiety, then they learn coping techniques, and last, they use their learned coping techniques to overcome the situation or the phobia. The vast majority of patients can be treated using the tailored methods. Now, in conclusion, I have informed you of what phobias are, their types, causes, and treatment. Although phobias seem bizarre and very rare, but they are not. Many people suffer from phobias that should be taken seriously. If you or anyone else you know suffer from any phobia, don't worry and consider treatment soon. Thank you.